The World Health Organization has declared the situation in the Democratic Republic of the Congo and other affected African countries a public health emergency of international concern. This declaration is the second in 2 years, calling for coordinated global efforts, including accelerated vaccine access and increased resources for surveillance and response. The WHO regions have been reporting Mpox cases since 2022, receiving reports of Mpox cases from 116 countries involved in the ongoing global outbreak. The rise in cases and deaths, particularly among children, is linked to the discontinuation of the smallpox vaccine and high malnutrition rates in affected regions. Sweden confirmed its first case of Mpox clade 1 in August 2024. The patient was infected in a region of Africa experiencing a large outbreak of clade 1 Mpox. The Swedish patient has received appropriate care according to health guidelines. India has recorded a suspected case of Mpox found in a man who recently traveled from a country suffering an outbreak of the virus. The government explained that testing confirmed presence of clade 2 of the virus, and that the particular strain is similar to 30 cases reported earlier in India from July 2022 onwards. In May 2022, the DRC confirmed a Mpox outbreak caused by the Mpox clade 1 virus. In June 2024, a mutant strain, clade 1b, was reported along the eastern border with Rwanda, Burundi, and Uganda, causing public health concerns due to its 10% mortality rate and association with miscarriages. Originally spread through sexual contact, the new strain can also be transmitted through close skin contact. Cases have been reported among school children, medical staff, and entire households. There are two types of the virus that causes Mpox clade 1 and clade 2. Clade 1 is responsible for the current rise of cases in Central and Eastern Africa. Historically, clade I caused higher numbers of severe illnesses than clade 2, with up to 10% of people dying from it. Recent outbreaks have seen much lower death rates of about 1 to 3.3%. Clade 2 is the type that caused the global outbreak that began in 2022. Infections reported from clade 2 Mpox are generally less severe. More than 99.9% of people survive. Clade 2 is endemic to West Africa. Both types of the virus can spread through close contact, including intimate contact with a person with Mpox, direct contact with contaminated materials, and direct contact with infected animals. What is the risk of severe disease? Although cases of Mpox are not life-threatening, some people may be more likely to get severely ill, including people with severely weakened immune systems, children younger than 1, people with a history of eczema, and people who are pregnant. The 2024 Mpox outbreak has affected 13 African countries, namely Burundi, Cameroon Central Africa Republic, Congo, Côte d'Ivoire, DRC, Ghana, Kenya, Liberia, Nigeria, Rwanda, South Africa, and Uganda. The situation is particularly concerning in the Democratic Republic of the Congo, which has reported more than 27,000 suspected Mpox cases and more than 1,300 deaths so far this year. The Africa Centers for Disease Control and Prevention, or Africa CDC, is a continental autonomous public health agency of the African Union that supports member states in efforts to strengthen health systems and improve surveillance, emergency response, and prevention and control of diseases. Africa CDC declared the ongoing Mpox outbreak a public health emergency of continental security, marking the first such declaration by the agency. This empowers Africa CDC to lead and coordinate health emergency responses across the continent, including mobilizing resources, enhancing surveillance, and strengthening health systems. The Africa CDC and the World Health Organization have launched a continental response plan to the outbreak of Mpox. The joint initiative aims to strengthen and accelerate African countries' response to the virus, supporting their efforts to curb its spread and to save and protect lives. It will get underway this month and run through to February next year, with an estimated budget of close to $600 million. The plan includes measures to strengthen surveillance, laboratory detection, case management, infection prevention and control, vaccination, risk communication and community engagement, and research and innovation. Mpox and other future infectious disease outbreaks are sure to occur as climate change and environmental destruction increase the risk of animal-to-human disease transmission. The global maldistribution of medicines for emergencies is not a problem Africa can solve on its own. A new set of global rules is also needed to ensure all countries work cooperatively to prevent, prepare for, and respond to pandemics, and to share vaccines and other needed medical products. This is vital, so the global vaccine inequity experienced during COVID doesn't happen again. WHO member states agreed to negotiate such an agreement in December 2021, but they missed the deadline they had set for themselves to conclude it by mid-2024. The draft WHO Pandemic Agreement, which negotiators hope to finalize before the next World Health Assembly in May 2025, proposes to fundamentally alter the international system of pandemic prevention, preparedness, and response. After 2 years of negotiations, the draft still risks repeating the profound failures of the COVID-19 pandemic by failing to align with international human rights law standards and principles. While not a pandemic at this stage, the current Mpox public health emergency reinforces the need for a concerted global effort to negotiate arrangements that ensure a fairer distribution of vaccines, medicines, and diagnostic tests. The ongoing negotiations for the WHO pandemic agreement are crucial. Let's discuss preventing Mpox. There are several ways you can protect yourself and others from Mpox. One is getting vaccinated. Check with your healthcare provider to find out if the Mpox vaccine is recommended for you. Avoiding close skin-to-skin contact with people who have a rash that looks like Mpox. Avoiding contact with materials that a person with Mpox has used, including sharing eating utensils and cups, and handling their bedding or clothing. If you do get Mpox, isolate at home, and cover lesions, and wear a mask if you must be around others. If you are in an area of Western or Central Africa where Mpox occurs regularly, avoid contact with live or dead wild animals. If you think you might be sick with Mpox, see a healthcare provider as soon as you can. The type of treatment for a person with Mpox will depend on how sick the Mpox is making you, or whether you're likely to get severely ill. If you have a weakened immune system, an active skin condition, or are pregnant, you may need certain medicines. Most people with Mpox recover fully within 2 to 4 weeks without the need for special medicines. Stay informed and stay safe. Thanks for watching. Please like and subscribe to our channel.